If you've been feeling overwhelmed and are ready to start therapy, one of the first challenges you might face is figuring out how to find your provider. Therapists typically don't display client reviews on their websites. In fact, it's considered unethical to solicit client reviews. So without straightforward and honest reviews, how can you find the right therapist for you? In this video, I'll be covering 6 steps to help you narrow your search. Number 1 is define your goals. It doesn't need to be crystal clear, but do you have a general sense of what's bringing you to therapy? What would you like to work on? Maybe it's grieving the loss of a loved one. Maybe it's switching jobs. Maybe there's another behavioral goal. You'd like to work out more, spend more time with your kids or partner. It can be anything, but do you have a general sense of what's bringing you to therapy? Many clinicians offer a free 15-minute phone consultation, and some even require to speak with you over the phone before scheduling an appointment. And they're very likely to ask you about these concerns or goals that are bringing you to treatment. So it's helpful to have a general sense before you have that phone call. Also, it's great to ask that provider, how would you help me address this situation if we were to work together in therapy? So it can give the provider a chance to respond and offer suggestions of how they might work with you in treatment. Number 2 is credentials and experience. Providers come with different qualifications and specialties. So a practicing provider can have a doctoral degree like a PhD or a PsyD, or a master's degree like an LPC, LCSW, LCADC, or LMFT. Hopefully I got them all. The main difference between a doctoral degree and a master's degree is often the length of course of study and the number of clinical hours required for completion. So in a doctoral degree generally takes 4 to 7 years to complete. That's coursework, research, and clinical work. And a master's degree generally takes 2 to 3 years to complete coursework and clinical work. The main thing that you're concerned with is, does this provider treat what I'm concerned with? And did they have the experience to treat what I'm presenting with? So a lot of that information can be gleaned from their online bio, from their website, and of course you can directly ask when you set up that initial phone consultation. Providers can specialize in treating a certain population, so only working with very young children under the age 6, or only working with veterans, or only working with expectant mothers. Or they may specialize in treating a certain clinical concern, like only working with individuals suffering from depression, or only working with individuals struggling with grief, and so on. Or a provider may specialize in a certain area of treatment or therapy. And that's actually the next tip, is what kind of therapy are you interested in? There's lots of different types of therapies out there. There's cognitive behavioral therapy, acceptance, commitment, psychodynamic, to name a few. I'll go over a few common therapeutic techniques in this video very briefly, and then I have another video where I go in more depth about these different approaches if you'd find that helpful. Cognitive behavioral therapy, or CBT for short, focuses on identifying and modifying dysfunctional thinking patterns, behavioral responses, and emotional responses. So you learn how to identify that your thoughts, your feelings, and your behaviors are all influenced by one another and influence one another. And the main path of treatment is through cognitive restructuring. So you're restructuring your thoughts so they are more rational and healthy, and you'll likely be assigned some behavioral exercises. Acceptance and commitment therapy, or ACT for short, is all about accepting and opening up to difficult thoughts, feelings, and sensations. So it's not so much about changing thoughts or fighting thoughts, certainly not about feeling guilty about your thoughts, but more of an opening up and then taking committed action towards acting on your personal values, even when it may be difficult or uncomfortable to do so. Eye movement desensitization and reprocessing therapy, or EMDR, has become popularized in the treatment of PTSD. So it uses guided eye movement tracking, or in some cases, you're pressing buttons and clicking buttons while retelling the trauma to reduce the intensity and the distress associated with those traumatic memories. Psychodynamic therapy explores unconscious processes and childhood experiences, and it's influenced on current behavior and current problems. So what you're bringing in the therapy room and how what you're presenting with now is really a reflection of what happened to you in the past, whether that's past relationships, past attachments, past trauma from childhood, and it's generally less directive of a treatment. just a quick note, because sometimes clients will say, well, I want to talk about this past experience or my childhood, but I also want to work with a CBT or ACT therapist. And yes, even if you choose to work with a CBT or ACT therapist, you definitely can still talk about childhood experiences. You're showing up to therapy as your whole self, and that includes your historical experiences that may have shaped you or influenced you or stuck with you. And so the key difference in the therapeutic approaches is in how your therapist maybe responds to the information you share, and how the therapist incorporates and understands this information into your current goals and your current functioning and current coping skills. Number 4 is logistics. This part is pretty straightforward, but it's important to consider in your search for a provider. Do you want to meet in person, or are you okay with teletherapy? And do you want to stay in network with your health insurance provider, or are you willing to go out of network for the right fit? If you're curious about out of network, it might be a helpful time before you begin your search, or while you're in the midst of your search, to just explore what your out of network benefits are, because that may expand your search options. Number 5 is use online directories. So there are a number of online directories that you can use to help narrow your search. PsychologyToday.com is probably the biggest and the one I most often recommend to people to use. There's also Headway that lists in-network insurance providers, ZenCare, Good Therapy, and TherapyDen. So let's stick with PsychologyToday.com. That's helpful because you can filter by location, you can filter by the gender of the therapist if that matters to you, insurance versus not insurance, clinical concern, and the age range. So you can specify if, for example, you're searching for a child, the age of the child, or adults or older adults. So the one thing I would caveat here is to just be wary of a profile that lists to be an expert in all areas, so treating every age group from very young children to older adults, or every clinical concern or a very large list of clinical concerns, and a lot of different types of therapeutic approaches. So it's just very rare to have expertise in all of those, to treat every age group and every clinical concern with any type of therapeutic modality. So that may be helpful to narrow your search of someone that's very specific with their focus, or very specific with the age population that they treat. Number 6 is personal fit. So this is kind of hard to figure out before actually meeting with the person, but this is where setting up those free 15-minute phone consultations can be helpful. How comfortable you feel with your provider is an essential ingredient to therapeutic success. It's something we call therapeutic alliance, and it's one of those really important, kind of tricky to measure variables in research. But we do know that comfortability you have with your provider is really important to the effectiveness of therapy. If you're already in therapy, but you're not sure if it's working out or if it's time to switch providers, I have another video where I go through a checklist of all the things you want to consider before telling it's time to switch therapists. Thanks so much for watching. I hope you found these tips helpful and found value from this video. If you have interest in working with me or setting up a phone call with me, feel free to reach out.